Good day everyone! I'm Sharina Makatangay, nursing student from Manila Central University. And today, we're going to do a procedure called obtaining electrocardiogram or ECG for short. The first step in the procedure is verifies the order. Confirm the client's identification and compare the name with the name on the client's bracelet. Provide privacy and explain the procedure to the client. Good morning po, Sharina Makatangay, nursing student from MCU. Ngayon po, mag-ECG po kayo by doctor's order for checking if may heart disease ka po. Mabilis and painless lang po ang gagawin natin, kaya relax lang po kayo, sir, habang ginagawa natin ang procedure. Do the hand washing, don gloves, a face shield, and a gown if needed, and follows the standard precautions. As you set up the machine to record a 12-lead ECG, explain the procedure to the patient. Tell the patient that the test records the heart's electrical activity and it may be repeated at certain intervals. Emphasize that no electrical current will enter his or her body. Tell the patient the test typically takes about 5 minutes. Ask the patient about allergies to adhesive as appropriate. Place the ECG machine close to the patient's bed and plug the power cord into the wall outlet. If the bed is adjustable, raise into a comfortable working height, usually elbow height of the caregiver. Have the patient lie in semi-Fowler's position in the center of the bed with the arms at the side. Raise the head of the bed if necessary to promote comfort. Expose the patient's arms and legs and drape appropriately. Encourage the patient to relax the legs and arms. Select flat, fleshy areas on which to place the electrodes. Avoid muscular and bony areas. If an area is excessively hairy, clip the hair. Do not shave hair. Clean excess oil or other substances from the skin with soap and water and dry it completely. Apply the limp lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The white or RA lead goes to the right arm. The green or RL lead to the right leg. The red or LL lead to the left leg. The black or LA lead to the left arm. Peel the contact paper off the self-sticking disposable electrode and apply directly to the prepared site, as recommended by the manufacturer. Position disposable electrode on the legs with the lead connection pointing superiorly. Connect the limp lead wires to the electrodes. Make sure the metal parts of the electrodes are clean and bright. Expose the patient's chest. Apply the precordial lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The brown or VI to V6 leads are applied to the chest. Peel the contact paper off the self-sticking disposable electrode and apply directly to the prepared site, as recommended by the manufacturer. V1. Fourth intercostal space at right sternal border. V2. Fourth intercostal space at left sternal border. V3. Halfway between V2 and V4. V4. Fifth intercostal space at the left mid-clavicular line. V5. fifth intercostal space at the anterior axillary line. And V6, fifth intercostal space at mid-axillary line level with V4. Connect the limp lead wires to the electrodes. Make sure the metal parts of the electrodes are clean and bright. After the application of all the LEDs, make sure the paper speed selector is set to the standard 25 M per second and the machine is set to full voltage. Ask the patient to relax and breathe normally. Instruct the client to lie still and not to talk while you record the ECG. Press the auto button. Observe the tracing quality. The machine will record all the 12 LEDs automatically, recording 3 consecutive LEDs simultaneously. Some machines have a display screen so you can preview waveforms before the machine records them on the paper. When the machine finishes recording the 12 LED ECG, remove the electrodes and clean the patient's skin if necessary with adhesive remover for sticky residue. After disconnecting the LED wires from the electrodes, dispose of the electrodes. Return the patient to a comfortable position, lower bed height, and adjust the head of the bed to a comfortable position. Observe and practice body mechanics at all times. Show calmness while performing the procedure.